Hello, runners. Hope all of you are doing well. This is Coach Bala here. Super excited to kickstart uh, episode 1 of this series that is very popular, has been popular for all the seasons. And for those of you who are sort of hearing it for the first time, let me explain a little bit about this, what this is about. This series is what we call it as podcast with runners, with you know. Like dignitaries, doctors. We have discussed with yoga exponents before, physical therapists. But the basic idea here is, as you all embark on this running journey or continue to be on this running journey, there's a lot of learning. At the end of the day, as I've always told you, running is about science and an art. And there's a lot of learning. And we believe that the learning should not happen only from one direction, that is just from coaches like me to you. Running should happen from 360 degrees from all directions. And this entire notion of this podcast with runners and other dignitaries started off with that thought process. And it has been a very successful, should I say, an initiative. A lot of folks look forward to it in the past seasons. And I hope this season also will be the same. We plan to do about 6 to 10 episodes every season. And I am so excited to kickstart that series with this episode, with this special person that we have. So for the first time in the history of Runners High, we are bringing in a psychiatrist to have a discussion, and that is our guest today. So without much further ado, let me invite a doctor to this podcast. And maybe, Doc, why don't you start off with a little bit of an introduction about you and who you are as a person, and then we can go from there.
Okay, namaste. Good morning to you from India. I'm Dr. Sumanth TK. I'm basically a psychiatrist from Bangalore. Hi everybody. Thanks Bala for giving me this opportunity to be here. It's such a wonderful place. So firstly, if I have to start with myself, then I would say that I was basically all my life I've been born and brought up and staying in Bangalore. And I did my schooling in Sri Satya Sai Lokaseva Vidya Kendra Alike, which is somewhere near Bangalore. And I was in a boarding because I was a naughty kid. So I did my PUC in KLE College in Bangalore. And I chose medicine as a profession. So I did my MBBS degree in Mysore Medical College. It's one of the premier institute in Karnataka, Bangalore. In Karnataka, India. So, and I did my MD in psychiatry in MVJ Medical College, Bangalore. During my internship, doing my MBBS, I fell in love with psychiatry, and due to various reasons, a lot of reasons culminated into me taking up this field, and I loving it every day of it. That's what I can tell you about it. After that, I worked in various institutes, and mainly since 2014, I've been working in a medical college setup called Rajarajeswari Medical College. Right now, I'm a professor at Rajarajeswari Medical College. Apart from that, I have my clinic, which I've been running from 2011 in Vijayanagar, Bangalore. Apart from that, I go to various hospitals in and around Vijayanagar as a consultant psychiatrist. So this is the professional part of me. And I'm married. My wife is again a Ayurvedic doctor who is a Panchakarma specialist, and I have 2 kids, a 6-year-old and 1 year and 5 months old baby. So they are all both handful and take all my time.
Your hands full, looks like.
Definitely. So it's very nice to be in a runners group. To be honest, I'm yet to begin running, but I'm more of a walker.
Yeah.
So I like trekking. I like going to mountains, and I like beaches. So I like touring around. Yeah, I really love trekking. That's what I said. I like walking. So sports, I'm into. I'm not a professional. For fun, I play football, and I'm into kabaddi and play some amount of table tennis and shuttle. So this is about me. So
Ah,
I
so many common themes here, Doc. Oh my goodness. Father of two daughters. Of course, my daughters are a lot older than your sort of phase of life right now. I love trekking too. So I have, apart from work and my family and my wife, three loves I have, or three passions I have: running, mountaineering, and golf. So it looks like you like to do mountain. We every year we host mountaineering expeditions, and I lead with my
okay.
friend. So maybe I'll ping you on my next one. Who knows? You might join me with one of those expeditions. But it's
Okay.
so exciting. Kabaddi. I used to play kabaddi in grade 12. The only physical game I've done was kabaddi. Somehow I enjoyed that game. So it's so good to hear that word kabaddi, and somebody else have also
All
played
right. Nice.
kabaddi. But awesome,
Okay.
Doc. Welcome, welcome, Sumanth, for to this program. And audience, I'm sure you have this question. Hey, Bala, why are we talking to a psychiatrist here? Right? I'm sure that question is there. So let me first address that elephant in the room directly, Doc. If you don't mind, give me a couple of minutes. Let me set this up correctly. So, folks, there is a beautiful logic why we are starting the season with Dr. Suman. Now, as you all know, Runners High, the vision of Runners High is always about creating, developing, nurturing, and connecting amazing human beings. That's really what we are trying to do. And running is just a platform on which we are trying to create amazing human beings. One of the beautiful facet of an amazing human being is that that person is in a state where he is able to give more than take. That is one of the sort of features of an amazing human being that we try to develop. So the state in which that person needs to be for that person to give the best of that person to others is when that person needs to be in a happy state. Only when you're happy, you can think about others. If you're struggling with pain and so many other things, where I mean, it's logical, you won't be thinking about others, right? So physical fitness definitely drives that state of being amazing to others. But then, very interestingly, someone gave an idea that mental fitness is equally important too, and I 100% agree. Physical and mental fitness coming together is what drives a happy human being. And I'm so glad that Renu brought this up with me. Yes, Renu's good friend from her Bangalore days is Dr. Sumanth. And she was saying, like, we need to get thinking about mental fitness as well. And here we are, like a typical RHWB style. We just execute when a good idea comes, and we execute quickly. And that's really how all this started. And I have an exciting announcement on this towards the end of this podcast. So, first of all, I want to say thank you, Renu, for this brilliant idea. And I hope you all like that too and enjoy this discussion with Dr. Sumanth. So, Doc, my first question to you, assuming that I'm a layman, actually, you don't have to assume, I am a layman on all of this, is probably
Okay.
many of our listeners will probably have as well. What is psychiatry? Why should anyone even think about psychiatry? Like, when should anyone need a psychiatry? How do you sort of answer that question?
Yeah. So what is psychiatry? See, sometimes some of the most difficult questions are the basic questions, like what is psychiatry, what is mind, what is normal, and stuff. So if I have to put it in a simpler way, psychiatry is that branch of medical field that deals with mental health issues, deals with mind as an organ of an essential part of our body. Like we have all other organs, like we have bones, we have heart, we have brain, like a neurologist deals with the physical structure of brain. So we deal with mind. So in a complete definition of mind also involves mental health. Okay. So putting it in a very simplest form to understand what is mind. It's very difficult to define mind. That's I may be a psychiatrist. Believe me, it is difficult to define mind. But I can give you an analogy that's it's like mind. If comparing it to a simple computer, so mind is like the software, while the body is like the hardware.
Yeah,
So
I
as you
was
said,
thinking the same thing. Very
okay.
interesting you said.
So both mind and you just can't do anything with software. You need the hardware, and similarly, you can't do much with the hardware. You need the software. So and both should be in a good condition to be classified as, hey, this is a wonderful, amazing computer. So to say our body, both are very much interconnected. It is not like they are two separate things. So body has control over mind and mind has control over body, so both interact constantly. So for your overall well-being, we need to be taking care of the both things. And of course, and that's where we come in as psychiatrists. So we are the doctors who deal with ailments of the mind, not just the disease but also the health of the mind.
Yes.
Okay, so we
Wow.
are not just talking about the negative, we also want to create more positive. Yeah.
Exactly, Doc. Thank you. It's a beautiful. I will remember this. It's a wonderful way to explain it. I totally think you're absolutely right. At the end of the day, brain is the most important sort of hardware of a body. Without that brain, nothing works, as we all know. And you're right. If brain is the hardware, the mind is the software. I think it's fantastically well said. And psychiatry is about the software issues, bugs in the software, debugging,
Exactly.
or making sure that you are in constantly the software works well so it can control the brain activity, which is the hardware activity. And you're right, the neurologist takes care of the hardware portion, I guess, brain surgery, and psychiatrist takes care of the software issues, which you beautifully said. What about psychologists? I know there's one more field, psychologist, Doc. What is that? How would you sort of explain that?
No, see, it's not just psychiatrists and psychologists, but there are other mental health professionals as well. There are certain lay counselors, psychiatric nurses, psychiatric social workers. So there are different fields. We all are trying to help mental health issues, mental health per se. We all have a lot of common areas. I would rather say we have mostly common areas. If at all, in its basic way, we differ. Psychiatrists differ from psychologists in the form that we have a medical degree, so which allows us to prescribe medications. Okay, so it's not we can always see what patients, what clients with any kind of mental health issues, and so can psychologists. And we keep sometimes referring our patients whenever they need certain specialized help. So what tends to happen is, it's not a rule, but some medical doctors tend to focus on the medical aspects, prescription aspect, and psychologists, because they've been counseling into therapy a lot, so they tend to specialize more in that. It's not that doctors also can do therapy. Doctors, psychiatrists also can do specialization if they're interested. It depends on individual psychiatrists sometimes.
Got it.
Okay, no
It's
hard and fast rule there.
got it.
So
So the fundamental
basic,
difference is the prescription.
yeah,
I guess the
exactly,
got it.
yeah.
So in movies and all, again, I want you, I'm a layman here, but in movies and all, they show, right, the heroes or the heroines are having this one-on-one sort of appointment with the psychiatrist. Is that a psychiatrist or a psychologist, or it can be either? In the movie, like,
It can be either. It can be either. Yeah.
I see.
So again, it depends from country to country, and it depends on individual psychiatrists. Like, easy to some people want to do therapy. I like doing therapy, so I don't send many to psychologists because I love therapy. But there are doctors who do that. Okay.
Got
Yeah.
it. And when you say therapy, what I'm understanding is having chats and discussions and conversation
Exactly.
is what, as opposed to just, okay, you have this problem, go and do the blood test, and here is the medicine. That is not therapy, I'm assuming, correct?
See, therapy is a very broad word.
Yeah.
So we'll call it as a talk therapy, psychotherapy, and which has many ways to go about it. Even simple educational giving some education about the disease, the condition, what to do can be as a therapy. Even giving some sort of support can be a supportive therapy, or
Got
it
it.
can be some complex things like cognitive behavior therapy, psychodynamic therapy. There are some many therapies. So there
I
are,
got it. Got it.
yeah.
Makes sense. Makes sense. No, I'm just getting excited about this beautiful explanation. So let's step back here, Doc, for a second. So
Okay.
I think from my side as a layman, I've understood now. Hardware problems, neurologist. Software problems of your brain, not just problems, also keeping software bug free also
Exactly.
requires a therapist or therapy sessions or a medical session, and it is quite a normal thing for any software to have some bugs or the other. Because if I remember it well, Doc, say when I was like 20, 30 years ago, when I was like really 15 and 10 and 15 years of age, there was this taboo about mental health practice. Act of going to mental practitioner itself was like considered some kind of a taboo, and I think distinctly things have changed. Would you agree with me? Especially in the US, it's a very different thing. In fact, people
Yeah,
are.
definitely, definitely.
So what is your thought process here? Has it changed, or what are you seeing in terms of patients and support members of the patients?
Definitely it has changed and it is changing. But again, there's still a long way to go.
I see. I see.
So it is changing. Like people are getting more and more aware. So mental health issues are being addressed, or awareness has been created even in the schools, in all kinds of forums. Okay, and October 10th is celebrated as a World Mental Health Day. And so there is a lot of awareness going on. So every year this is increasing. And as you said, in certain Western countries, the awareness is even more better. And it is being taken. I can say it is much better. And of course, having said it is much better, there is still a long way to go.
To go.
That's what I
Exactly.
can tell.
See,
Yeah.
that's the first message I feel viewers I want to give is that let us take the taboo out of this in case you have it. It is simple software bug that can be completely fixed. There is no software in this world without a bug. So don't give me the don't even think about any, like, if you need a medical intervention to just clear the bugs, go and take a medical. It's as simple as I'm having a leg pain, I'm going to an orthopedic and figuring out it's a stress fracture. It's as simple. I mean, you should be thinking like that, because that is the key. And Doc, that lends me to the next question, really, which is most cases I've experienced, they don't even know that they have a condition, you know so it's not as if they don't want to go. They don't even, they means not just the patient alone, the family members. They just think that, hey, what is happening here? They're not able to understand this. Like, it takes someone to come in intervention and say, hey, you should go and meet a psychiatrist right now, kind of thing. So from that perspective, just to throw some light, what are the typical sort of ailments that generally you see in the population that comes to you or in this field?
Yeah. Yeah, thank you, Bala, for this question. Of course, there's a lack of awareness. What exactly should I be going? I think maybe a part of the problem why people don't approach us is they don't know what to go about for, because defining normal itself can be very difficult. What
Correct.
is normal? So we are anxious, but then again, what constitutes abnormal clinical anxiety or clinical depression? My simple definition before I start answering your question is when your psychosocial occupational functioning becomes difficult, when your day-to-day activity is difficult, becomes difficult due to your mental health issues like your anxiety or depression. It's not that we all don't get sad sometimes, we all don't get anxious sometimes, but when this anxiety or sadness or whatever other mental health issues creates enough problem for our functioning in our day-to-day life, in our work, in our family, in our space, that's when we think you should not even think whether it's not. You just go out and ask your psychiatrist. Maybe he'll say, no, it is nothing, man, this is normal. Or he'll say, okay, I think this is something that we need to look into. Yeah, coming to what are the common things, some of the common ones are anxiety, depression and psychotic symptoms, substance abuse, and personality issues. And yeah, these are some of the common ones.
common manifestations of
Okay.
a software bug, you're saying.
Yeah. Yeah. Common conditions. So common group of conditions, I would put it.
Got it.
Okay.
So
There are others as well. Yeah.
got it. So let's do a double click. Let's, for the sake of this discussion, anxiety, depression, substance abuse, and then what was the fourth one you mentioned?
Psychotic disorders.
Psychotic disorders, like some
So,
changes in behavior and that type of stuff. You're saying, right?
yeah.
So everyone faces anxiety. Like of course, before a big client meeting, I'm just like eating my fingers. I'm anxious, obviously. Everyone faces depression from the time to time. I've had times when I had the greatest project, and then that project just didn't take off, and I'm like just sitting, what the hell? I wasted my last 6 months, and I'm depressed for a couple of days. Like depressed as I don't feel like doing anything. I'm like, what the hell, man? This is just pointless working hard. I'm sure all of us go through that. So my question to you is, what level is normal, and what level is you need to talk to someone? How would you sort of guide us?
See, I think I answered that just previously. What I would again tell is defining normal is something very difficult.
Oh, I see.
Normal can be different for different people. Maybe the first thing I would always ask the question is this change? Like, I've been sleepless since the past 1 month. Like when you say that, we compare it to what was normal. So the patient or the client would always come and say that since past 15 days, I'm very anxious. What he means is earlier I was not like this. So you're comparing, the comparative would be your own self. Like you had a normal, but now things have changed because of so and so. Maybe something happened in my personal life, something happened in my work life. So each normal would be a normal, or something abnormal would depend on the particular client. And as I said, I would always suggest people, when if they find something is abnormal, even they had an inking, just come and meet a psychiatrist. There's nothing wrong. It's like you have some abdominal pain, it need, or some headache, need not be you should have some brain tumor to go to a
Correct, correct.
you can always go approach, and maybe they will evaluate, they will ask you a few questions and guide you. So they will say, no, I think it still sounds within the normal range, so you don't worry, go home, you take care of yourself, and do some simple things, they will say.
Got it.
But if
Beautifully
they
said.
yeah.
Beautifully. No, it's very, I absolutely agree with that. So the one sort of follow-up question is a sort of a lack of sleep or not able to sleep, is that a common symptom across all the things that you mentioned?
Yeah. So I did say that, as I said, software, hardware, they are very much connected. The body and mind are very much connected. So whenever we are anxious or depressed or psychotic, one of the first thing we do see, which is very a reliable factor, is there is a disturbance in your biological behavior. So the common biological behaviors are biological rhythms, like your sleep. So either sleep is very disturbed, and either very increased, or very most often very decreased. Your appetite is decreased, or I sometimes increased, like emotional eating. And your sexual life, again, another one biological behavior, which is very decreased or increased depending on the condition. Okay, so these are three biological areas which whenever, so first thing, my logical question would be, okay, you are anxious, so always been how has your sleep been? Because if you're anxious, you're probably, your sleep is going to be messed up, and that's also an indicator whether you're improving. Let's say I treat them with medication or therapy, so one of the first things that starts improving is his sleep again. So many times we tell our patients, if your symptoms are relapsing, maybe watch out for your sleep. The day your sleeps are getting messed up, maybe is the day that maybe symptoms are relapsing. Maybe you can come very early rather than it getting blown out of proportion and
Correct.
then coming back to us.
Absolutely. So, you mentioned this anxiety, depression, substance abuse, and psychotic. So, what do you exactly mean by psychotic behavior?
Okay. So yeah, psychosis is what, see, when we talk about mental illness, mad, crazy, Usually people are not referring to anxiety and depression. They are actually, in the lay terms, when the stigma that is created is due to psychosis. Oh, there's this lunatic or
Or behaving
absolutely psychotic
erratically and
person.
that type of stuff.
Yeah. So to put it in a very simple way, psychosis is where you lose touch with reality. Okay, it could be something like psychotic disorders like schizophrenia, or something like an bipolar disorder, where you lose touch with the reality. That is, you don't know what is real. The boundary between what is real and what is not real gets blurred. So these kind of people can have something like thought issues like delusions, where they believe something very strongly and firmly. I'm not saying everybody has beliefs, but these are beliefs that are not in keeping with the reality or socio-cultural norms and not easily shakable. Then you have hallucination, that are perceptual disorders. That is, you're sensing things, you're seeing or hearing things that are not there. So this is not reality. Okay. And the way you talk, it can be abnormal way of communicating. So this can also have some amount of anxiety and depression along with it. So basically there is a loss of touch with reality. Okay.
Amazing. Wow. Totally clear. It's so perfectly clear. So let me attempt to summarize this section before we go to the next one, and tell me if I'm doing an okay job in a very beautifully said answer to that question. So the way I would summarize it is like maybe a 3 or 4 bullet points. Bullet point one is hardware, software bug is, or keeping the software up to date is really what the psychiatric field is about. So it's totally normal to have some kind of bugs in software, like it is totally normal to have a fracture, like it is totally normal to have a throat infection. It's the same thing. So take out the
Exactly.
time is the first point that I want to summarize. The second point is the manifestation of this software bug. There might be many different manifestations, but typically you can, 80-20 rule, you can subject to your 4 fundamental sort of things. The way to do that is because normal is depending on individual people. So it's almost like an internal benchmarking. How you were normal before, and then after a software bug, how that you have deviated away from where you were before, is the essential idea behind abnormal. Because what could be normal to me could be totally abnormal to you, or the reverse. So that's why it's about internal benchmarking with your own thing. So that's the second sort of bullet point, where you generally see the trend, how you used to be before and how you are right now. And if something is sort of way out of whack, then probably software bug is there, and you might have to go into talk to some professional help. That's bullet point two. Bullet point three is the manifestation is anxiety above or below the normal. Depression, feeling like don't feel like doing anything, above or below the normal. Substance abuse, above. I hope you don't have any normal use of substance. So, of course, if you're using some substance abuse, that also is a issue of where software thing. And finally, psychotic, which is like disconnect with reality. Suddenly start thinking about things that you never started behaving ways that you never behaved before. Have no idea about what is happening around you, and you're just like randomly throwing things. And when I say throwing things, not physically, maybe physically as well, but also mental thoughts to everybody. So these are the sort of the 4 manifestations of and against the internal benchmark of your own, how your normal life used to be before. So that was the third sort of bullet point that I gained. And then the final bullet point is, when these things happen, there are some early telltale signs. That early telltale signs or disruption in normal biological behaviors, or what did you say, normal biological functions. And what are they? Sleep. If sleep pattern gets disturbed, used to be a good 6-hour sleeper, and suddenly you're not able to even sleep for 2 hours, we have a change in normal function. Second one is eating habits. Like you used to eat well, and suddenly you don't feel hungry at all, or the other way around, you're like just going after eating like crazy. Then there is something there, some software bug possibility is there. And then third one is sexual sort of appetite, high or low. These are the 3 you mentioned, which is a good telltale sign for a software scenarios. Have I summarized this well, Doc?
Oh, very well, very well. Yeah.
Awesome. Okay, good. I'm learning. I'm excited. So, Doc, let's go to the next question then. How do you treat it? Typically, what does the treatment look like?
Yeah. So Of course, each treatment is individualized because there are, while these are disorders, there are triggers which are unique for each person, and we need to get in touch with them. So basically, firstly, we need to diagnose this condition. So in psychiatry, it's not like you have an MRI or ECG or some scan you do and you come to know. Of course, we do use them, but it is basically we rely on history. So we talk to people and we talk to closed ones who know enough details about the person. And based on that mostly, and using certain scales, or sometimes we do come to a conclusion or a diagnosis. So having done that, we try to rule out any physical conditions that might be related to the sort of psychiatric conditions. So the treatment would mainly happen in three ways: certain lifestyle changes, medications, and therapy. Okay, if I have to put in the three most, of course, there are other somatic therapies, we call it. We rarely use that, like something like electroshock therapy or RTMS or these other treatments. Okay, so the first would be always lifestyle changes. See, the thing is, most of these mental health issues do occur because of our own various imbalances. So we don't exercise enough, we don't follow proper diet, we don't keep social contact with people.
Yeah, yeah,
So, so this is where I think runners high with Bala will come in. So
yeah.
helping people have a physical, maintain their physical health. So in fact, my go-to first thing I would always tell my patients would be trying with start up with exercise. So it has its own benefit.
Yes.
This is the natural way of beating depression, anxiety, because what chemicals we give as medicine, some amount of it actually comes through doing maybe running or exercising, yoga, meditation. So a lot of these chemicals are secreted naturally. The medications are basically artificially we are introducing because it is the levels are so depleted, or the condition is so bad that we need to do some artificial intervention. Okay, so having good diet, eating healthy food, and social contact, touch. So many of us don't hug each other enough. So we are out of touch with people. So there's an hormone called oxytocin, which is one of the four happiness hormones, which gives us happiness. So basically holding hand with your loved one, holding a baby, even that can help you. Okay, so we focus on the initially we focus on the lifestyle changes, which is very important. Then comes the medications. So medications, not all medication will cure it, but medications have a supportive role. Okay, the thing is, the burden of the anxiety, you keep getting so much anxiety thoughts, it's difficult to deal with it just by therapy. And that's when medicines come in role. So nowadays we have excellent medicines. Maybe not all medicine will suit everybody, so some amount of your doctor will go through a trial and error sometimes, but they should mostly be able to guide you with a good medication. So this is one way of dealing with it. And the other one is talk therapy. So there are a number of therapies. So this is where in its basic form, a therapist or a doctor or a psychologist forms a bond with the patient, and they both sit to, it's not doctor like guru telling you should do this, you should do that, you should do, no, it's a mutually, we work out things, we talk to each other, understand what is possible, what is not possible, and come up with a way to resolve things. Okay, so these are main ways we go about. I'll not go into very detail about what each therapy is. It's a very big topic. So
Of
I'll say
course.
these are the ways we go about it.
That's brilliant. And I have some two or three golden nuggets that you sort of uttered, and I just want to make sure I call that out. So, folks, one of the things Doctor mentioned was about the first line of defense after, in terms from a therapeutic treatment standpoint, is some kind of physical activity, right? because doctor, if you remember what doctor said, it secretes hormones that sort of, it's a happy hormone that naturally created by the body, and that actually elevates the mood and all that good stuff. Well, let's come out of this discussion. Where have we listened to this? Well, that is runner's high. That is what we keep saying, runner's high with Bala. That is the runner's high, guys, that you experience every time after a run. When you have so doc, this is runner's high. Name was meant for that. There is a scientifically proven thing that runners run and they get a high after they finish a run, like a actual high, like a feeling of amazingness, and people get hooked onto it, and that's why people run, especially long distance runs. And I'm sure you would have heard it too in other things. So it's very interesting you mentioned that. That is the core reason for the name of this club. Runners high is to create that very positive hormone that we can create through running. So I'm glad that you mentioned that. So folks, another reason for you to do a good job in our season is just mental health. Forget about the physical health for now. So that's the first golden nugget that you mentioned so beautifully. The second one you talked about in terms of the connection with social friends and such. You are 100% right. Thanks to internet, thanks to this, people have, especially in the US, as you probably would know, people have become, not in our age group, but maybe definitely in our age group too, they've naturally become just sitting alone and just talking to other people in social media, for instance, right? While that is good in other things, the worst thing is there is no social connect. And I know man is a social animal. We need a social connect. And one of the primary vision of Runners High is creating a network of amazing human beings. The network is the idea, and we host many different functions, and for this exact reason. So runners, as a side note of this, as a corollary of what doctor said, come and participate in all the events. Join our race day. You can always go to other race days, but come and join race day along with us, because we are, as a family, we are doing something together. You meet fellow runners together. We host parties. In between seasons, we host parties. Come and join the parties. There are so many of non-New Jersey runners have actually flown into New Jersey for the race day. You should do that too. Not because you can't get other places to, doc. We host a race day for the end of the season. We host it in New Jersey because that's where the critical mass is. And a lot of folks come there. And I'm just thinking through this lens, you should make that visit, that drive, and come and meet all of us, share the New Jersey love, the runners I love, and do the race day. These are all ways in which that second bullet point the doctor mentioned, which is social, increasing, enhancing social connect, is always going to be there. Contribute, give more, connect with more people. You go to a new city, ping in our group, hey, is there any runners I runner here? Go and meet that person. I do it all the time. It's always a pleasurable experience. Whichever city I have traveled in the world, I go and connect with RHWB runners, and it's always a fun, great time. It's like long lost brothers and sisters meeting. That's how it feels every time I connect. So that was a great thing you mentioned. On the medicinal thing, doc, there's just only one layman question I have. I know that, some of the friends that who have gone and helped, they also take a blood test, and what is the idea behind blood test and some medicines? Is it only for putting them to sleep, or there is some chemical imbalances that also creates a requirement for a medicine?
Yeah. Firstly, let me tell you about the medicines per se. See, so different. Of course, it is not just one particular medicine. There are many medicines. So, what this medicine tend to do? Each medicine has its own effects. So, there are certain neurochemicals like serotonin, dopamine, norepinephrine. So, these are the brain chemicals in the brain. So many times there is misfiring of neurons, there is an imbalance in the chemical levels. To some extent, it is not an ideal thing, but to some extent, we are trying to rebalance these chemicals. Okay. So, because by doing that, the pressure of this mental health issue on the client or the patient comes down. So let's say there is this person with depression or anxiety who's having, let's say, 1,000 negative thoughts coming to his head every minute. So he's having difficulty dealing with this. So when we give medicines, to a good extent, maybe if not the 1,000, maybe 70% or 80% subsides down. So what happens? We create condition for the client to be able try to fight the remaining 20, and as and when he is able to deal with that, so once he starts getting the confidence, the experience of dealing with it, gradually we decrease down the medication. I'm just telling you in a very simplest form. So
Got it,
basically
of
there are
course.
certain chemicals are down and we are trying to replace it so as to create as normal a condition in the brain chemical wise. Okay. So, and your second question, yes, see, psychiatry as a field is still developing. So there are medications each day introduced. Some tend to work, some don't tend to work. But what we do is always try to see what fits you better. So it's again an interaction. We keep asking, how is this? Is it helping you or not helping you? As I told, not all medication will help everybody. So we have individual preference, certain metabolic differences in our body, which will interact with our medicines. Okay.
Got it.
Why do we do blood tests? We don't do blood first. Firstly, we do a baseline blood test many times, like see your sugar levels, lipid profile, like your cholesterol levels. So see that what's your baseline, and at regular intervals we do compare it with the baseline. Are our medication in any way, because medicines of course do have certain side effects, and we are monitoring it always to see whether these side effects are getting beyond the permittable limits, or are they causing any dysfunction or any problem. So we can take immediate action on that. Again, there are certain medicines which needs to be monitored the level, because there's an ideal level. Only when the medicine reaches the ideal level in blood it starts working, and maybe beyond a level it might not be good, it can be harmful, or below a certain level it can be of not much use. Okay, so that is one way we monitor. There are just few medicines we do that, but mostly we are monitoring the biological functions to see whether there are any side effects or anything like that. Okay.
Very fascinating. I mean, it's just so. I mean, if I had a choice to go back in life and choosing medicine, probably I would have done what you did, Doc. I think this is a very amazing field. You know, software controlling the hardware, and software bugs to solve for. Its immediate sort of value you can drive to people's lives. You know, so it's fantastic. Thanks for that. So let's talk next steps, Doc. You know, there is I'm very excited actually, Doc, to launch runners to launch a major initiative for our community, and this is all thanks to Doc, Sumanth and Renu, sort of good friends, saying that, you know what, I love what you are doing for your runners. Community is good. I see what the mission is. And they asked themselves, what can I do to help? And we had some discussions, and I think we have come up with something very exciting. And I wanted to formally launch that right now. And so I would actually ask a doctor to sort of talk a little bit about that. I'll just give a small introduction of that, and then maybe you can talk a little bit about how that could work. So the idea here, guys, we would like to launch what is called as a mental health helpline for our community. And the objective of that is essentially what we just now discussed, which is we want our runners to reach that happy spot. And physical fitness and mental fitness together takes you to the happy spot. So that's our objective. And we know that to get there, you need to have someone to talk to, you know. So especially, Doc, 90+% of our runners are in the US. So, I know that in the US, it takes some time to find the right person. And it's not like you can suddenly go and then tomorrow you can go and talk kind of thing. So there is always, especially if you don't even think that you need it, but you just want to have a chat to see whether I need it or not. Definitely, then it's a very difficult, setup here. So we wanted to address that and provide what is that mental health helpline. So the idea here is Doc is very busy, but he said, I will give my time whenever is needed to have an hour, up to an hour, maybe 30 minutes, an hour, chat one-on-one, only you guys, nobody's involved. It's just a very private thing between yourself whenever you need it and the doctor. And sort of do all the things that doctor just talked about. So what do you think? That, have I captured that correctly? Is there anything else you would want to add, basis how it should work?
Yeah, I think definitely I can definitely help you. So what I can provide, what if I want to elaborate on what I can provide, is that look, as I am based in India, I will definitely be not be able to provide you any medications. But what I can definitely provide is a first point of contact, in the sense I can be a consultant whom you can consult about how do we go about this, what are the probably maybe in some way first aid or in some way information. So because you do have information in Google, but it is so enormous, we might end up getting more misinformation. So, and when we read it out, so we might misunderstand what exactly is being there. So what I can definitely provide you is, in one way, is this something, when you come up with issues, is this something to worry about? Is this something that needs to be taken action? And how do you go about it? What and all can be done? Whom to contact? Who would be the best person? And from my suggest, what I would ideally be doing, and on the lifestyle or the therapy, what you can adapt or do. So these kind of questions I can address you. So this is what I can do from my side. I will definitely be happy to do it from for you. Yeah.
Amazing. So I remember you were mentioning that there is a therapy portion of it, there is a prescription portion of it, and there is just kind of understanding the patient's normal, abnormal trends. I'm assuming 1 and 3 you will be able to sort of provide a decent starting point. Was that fair to say?
Yeah, I think educating therapy, complex therapies might not be, because I would always encourage to meet somebody locally.
Yep.
So whatever I can do, I will do. But it's always good to have face to face on a regular, because again, I would have my own time restrictions with my own busy schedule. So I don't want to make certain false promises, but I will be there to help you in whatever
Correct.
way I can
Like a
help.
first line of attack to start with.
First line, yeah, I will say. So I would always, my basic, wherever people from abroad or wherever other countries, faraway place, always them, please get linked with the local psychiatrist. So is what I would always encourage. But you can always have a second opinion. Sometimes people may not be convinced, or maybe they would have their own doubts. So about any issues, so I can give my second opinion to you. Okay.
Beautiful.
So yeah.
No, I can totally see that, Doc. Thank you for doing that. So, folks, the way this will work is we'll have a dedicated page, mental health helpline, in our website. We'll have doctors sort of a short bio, as well as I'm assuming you're okay, comfortable putting your contact number there. WhatsApp would be
Sure,
ideal,
sure.
right?
Okay, yeah,
So,
I had idea.
yep. So we'll put in the WhatsApp number there, and I'll also share it with all of you. So all you have to do is click on the helpline page. You will see the doctor's sort of bio and the number. Just literally take that number, WhatsApp him, introduce yourself, say that you're a runner, sort of runner, and just introduce yourself, and then don't immediately expect immediate response from doc, because he's also having a day job. But you can be rest assured he will respond at some point soon. Should we say in the 48 hours is the max within which you can respond? Is that fair to say, doc, or we need?
Yeah, I think, yeah,
Within the
I'll
48
definitely be
hours
doing
he'll
it.
respond. And the idea here is, after that, you two are just talking to each other, and then you maybe set up your first appointment on the phone basis, your timing and doctor's timing, and have a session. That's the basic starting point of this. And that session could be doctor understanding your situation, maybe hearing from you, guiding you on what could be the potential options, what all things are there, all the thing. I mean, I'm not a psychiatrist, I can't say too much, but something like that is the first step for you to talk to a professional. That's the basic idea. And and then doctor has been so kind. So he, I said that no, this is not something, cannot be pro bono, because you're also spending your time. So a very, very nominal, just 1,000 rupees per hour. Is that fair? Is that, am I saying it
Yeah,
correctly? Just
yeah, yeah.
1,000 rupees an hour. is the very for respecting doctors' time, is what he said. He's happy with that. So when you are discussing, I'm sure he will share his account and all that. You should ask for it, or I will also maybe I don't know, maybe I can put it in your page also. In that way, you don't even have to ask; they will just Zelle it or PayPal it or whatever way,
Okay, sure.
and that's it.
Sure.
1 hour, 1,000 rupees. I mean, it's like we just go and have a couple of Starbucks coffee. That's like it's like that, and so.
Okay.
So that's the deal, guys. I hope this is helpful. I hope that you all will make full advantage of it and help us also improve on it. And Doc and Renu, thank you for like sort of asking that fundamental question: What can I do? What can I do to help? What can I give?
Yeah, thank you.
That question led to this podcast and led to this idea. And Doc, we have done this in our professional. I come from a merchant navy background, and our shipping company did that. People on the sea always alone, and there is a lot of mental sort of pressure. And we started this a long time ago. I'm talking about 5-6 years ago. And man, this line has been the most helpful. Like actually, it was almost like a suicide, call it a prevention line as well, because of this exact reason, because people are having so much pressure. They are in the middle of the ocean, pressure, nobody to talk to. So all the things you mentioned, I could relate to from a shipping on the ship, sort of a high pressure job. And these really helped. And there is a statistic that they actually help so many people from doing something really bad kind of thing, because of this one thing, just talking to someone who knows how to talk and how to sort of diagnose. So looking forward to that, Doc. And I also look forward to coaching you at some point. You said you're only a walker. You know what? If you ask my friends, they will know that once you connect with me, I will hook you. And I am going to hook you and bring you in as a runner at some point, maybe next season. What do you think?
Okay, sure.
So thank you, Doc, for your time.
Yeah.
Super pleasurable conversation with you.
Okay.
Any final thoughts from you? Would love to hear, and then I'll close it.
Yeah, it was really amazing having you here, having been in this program. Very wonderful interacting with all the. These are all wonderful and basic. I think these are very informative questions. And I'm thankful for this opportunity, and I think I'm looking forward to being with the helpline and helping out people. Okay.
Thank you.
And yeah, I think thank you.
Let's drive happiness to many more people in this world.
Sure.
With that very uplifting thought, I just wanted to thank you on behalf of entire Runners High. Thank you, and Renu, for coming up with this idea. And I will come back to you with when we launch this with the right website, and I'll take your numbers from you. And of course, Renu probably has your details as well. So I'll put it all together, and then we'll go from there. And please let us know if there is any other way we can help. Thanks a lot for your time, and have a wonderful weekend.
Thank you very much.